Hello everyone and welcome back to my channel. Before we dive into the potential dangers of untreated low blood pressure, let's quickly define what low blood pressure, or hypotension, is. Generally speaking, it's considered to be a blood pressure reading below 90/60th millimeter of mercury. Now, while some people may experience low blood pressure without any symptoms, it can become a serious health concern for others. Symptoms of low blood pressure. Common symptoms include dizziness, fainting, fatigue, and blurred vision. These symptoms can be quite alarming and can result in falls or accidents, especially in older adults. It's important to listen to your body and consult with a healthcare professional if you notice these signs. Long-term effects. If left untreated, low blood pressure can lead to several complications. 1. Shock. Severe hypotension can result in shock, a life-threatening condition where the organs don't receive enough blood and oxygen. 2. Organ damage. Prolonged low blood pressure can cause your organs, especially the kidneys and brain, to not function optimally, potentially leading to long-term damage. 3. Mental confusion. Inadequate blood flow to the brain can lead to confusion, difficulty concentrating, and in serious cases, loss of consciousness. In severe cases, low blood pressure can lead to shock, which is a life-threatening condition that requires immediate medical attention. Low blood pressure can be caused by a variety of factors, including dehydration, infections, heart problems, medication side effects, and other underlying health conditions. It is important to work with a healthcare provider to determine the underlying cause of low blood pressure and develop a treatment plan to prevent complications. In general, low blood pressure is not as serious as high blood pressure, but it can still cause health problems if left untreated. It is important to monitor your blood pressure regularly and seek medical attention if you experience symptoms of low blood pressure. Causes of low blood pressure. It's essential to identify the underlying causes of low blood pressure, which can include dehydration, severe infections, blood loss, nutritional deficiencies, and certain medications. There are several common causes of low blood pressure, including 1. Dehydration. Not drinking enough fluids can cause a decrease in blood volume and lead to low blood pressure. 2. Medications. Certain medications, such as diuretics, beta blockers, and some antidepressants, can lower blood pressure as a side effect. 3. Heart problems. Conditions such as heart failure, heart valve problems, and abnormal heart rhythms can cause low blood pressure. 4. Endocrine disorders. Disorders such as thyroid problems, adrenal insufficiency, and low blood sugar, hypoglycemia, can lead to low blood pressure. 5. Pregnancy. Some women experience low blood pressure during pregnancy, especially in the first and second trimesters. 6. Neurological conditions. Conditions such as Parkinson's disease, autonomic dysfunction, and nervous system disorders can affect blood pressure regulation. 7. Severe infection. Septicemia. Blood pressure can drop dramatically in response to severe infection, leading to a condition known as septic shock. 8. Postural changes. Some people experience a drop in blood pressure when transitioning from lying down or sitting to standing up, known as orthostatic hypotension. It is important to work with a healthcare provider to identify the underlying cause of low blood pressure and develop a treatment plan to manage symptoms and prevent complications. When to seek help. If you're experiencing chronic low blood pressure or any of the symptoms mentioned, please don't hesitate to reach out to your healthcare provider for a thorough evaluation. They can help determine the cause and recommend the appropriate treatment. Can low blood pressure be hereditary? There is some evidence to suggest that low blood pressure, or a tendency towards hypotension, may have a genetic component and could be hereditary. Studies have shown that blood pressure regulation can be influenced by genetic factors, and individuals with a family history of low blood pressure may be at higher risk for developing the condition themselves. However, it is important to note that genetics is just one factor that can contribute to low blood pressure. Lifestyle factors, underlying health conditions, medications, and other environmental factors also play a role in blood pressure regulation. If you have a family history of low blood pressure or if you are concerned about your blood pressure levels, it is a good idea to talk to your healthcare provider. They can help assess your risk factors, provide guidance on monitoring your blood pressure, and recommend lifestyle changes or treatments if necessary. I've noticed that I often feel lightheaded when I stand up quickly. Could that be a sign of low blood pressure? Feeling lightheaded or dizzy when you stand up quickly is a common symptom of a condition known as orthostatic hypotension, which is a sudden drop in blood pressure when you change positions, such as from lying down to standing up. Orthostatic hypotension can be a sign of low blood pressure or underlying health conditions that affect blood pressure regulation. Orthostatic hypotension can occur for various reasons, such as dehydration, medication side effects, autonomic nervous system dysfunction, or nervous system disorders. It is important to pay attention to these symptoms and discuss them with your healthcare provider to determine the underlying cause and appropriate treatment. If you frequently experience lightheadedness or dizziness when standing up quickly, it is advisable to take precautions such as getting up slowly and staying hydrated. Keeping track of your symptoms and discussing them with your healthcare provider can help identify the cause of your symptoms and ensure appropriate management. Is there anything I can do to prevent low blood pressure? There are some lifestyle changes and measures you can take to help prevent low blood pressure, including 1. Stay hydrated. Dehydration can lead to low blood pressure, so it is important to drink an adequate amount of water throughout the day. 2. Eat a balanced diet. Eating a healthy and balanced diet that includes plenty of fruits, vegetables, whole grains, and lean protein can help maintain a healthy blood pressure. 3. Avoid alcohol and caffeine. Both alcohol and caffeine can cause dehydration and lower blood pressure, so it is important to consume them in moderation. 4. Exercise regularly. Regular physical activity can help improve circulation and maintain a healthy blood pressure. 5. Monitor your blood pressure. Keep track of your blood pressure readings and consult with your healthcare provider if you notice any significant changes or symptoms. 6. Get enough rest. Make sure to get an adequate amount of sleep each night to help regulate your blood pressure levels. If you have persistent low blood pressure or experience symptoms such as dizziness or fainting, it is important to consult with your healthcare provider for further evaluation and guidance. In conclusion, while low blood pressure may seem less serious compared to high blood pressure, it poses significant health risks if not addressed. Remember, it's always better to be proactive about your health. Please like, subscribe, and share this video with anyone who may benefit from this information. If you have any questions or want to share your experiences, leave a comment below. I'd love to hear from you. Thank you for watching, and take care.